Hello, welcome to this NMC OSCE tutoring video. My name is Hannah. I am a UK registered nurse of 20 years, a university lecturer of nearly 7 years, and I've been an NMC OSCE programme lead. And I'm sharing with you my advice and teaching to help you self-study and prepare for your OSCE examination. So please like and subscribe. Thank you for some of the comments that have been put in my posts and some of the feedback that people have sent me about their videos, helping them to pass the OSCE, which is absolutely brilliant. I really want you to be able to use these videos to support you as much as possible. So today I'm going to look a little bit more in depth around the holistic assessment. This sometimes can be a little bit tricky, thinking about what type of questions you need to ask and in order to cover that holistic assessment. Right, let's get started then. So, holistic assessment forms part of your assessment station in your API. So if you look at the assessment marking criteria, you'll see down at the bottom it says something like conducts a holistic assessment relevant to the patient's needs. And so you are expected to carry out a holistic assessment, which is relevant to your patient scenario. And what you need to do is to read your scenario briefing and background really carefully and pick up key information which covers the physical, psychosocial, spiritual and sexual needs of the patient. Now, you won't have time to do a really in-depth and thorough nursing assessment as we would do in practice, because you've only got 20 minutes for this whole station. And by the time you've done your A2 assessment, documented your news to, you may have maybe 5 to 7 minutes left to do your holistic assessment. So it's not a very long amount of time. So you do need to identify in that briefing and scenario background information, the really relevant key pieces of information related to that patient, which you're going to follow up with in your holistic assessment. So what is holistic assessment? It might not be something that you are used to from your training in other countries, but it's very much embedded in UK nursing practice. And it's about evaluating all aspects of the patient and treating them as a whole person, really. And it's about identifying what's most important to the patient as well and their needs and wishes. And in terms of your NMC OSCE, you need to demonstrate that you are evaluating all aspects of the patient's well-being, including their physical health, their psychosocial, their spiritual and their sexual health. And holistic assessment is really important because it ensures we're doing a comprehensive patient care and delivering that. It does lead to improved patient outcomes, and it does enhance that nurse-patient relationship as well. And it's about really assessing what's important to the patient, because what we view as the health professional as being the most important thing may not be what is the most important or pressing concern for your patient. And like I said, it's about understanding the patient as a whole and addressing all their needs to really promote optimum health and well-being. And so you're working in partnership and collaboratively together. That's really, really central with your holistic assessment. And like I said, it is really important because it demonstrates, comprehensive care. So addressing all dimensions of patients' health, being really patient-centered. So really respecting and responding to the individual patient's preferences, needs and values. And that's important in your OSCE because you need to listen to what your patient actually is saying and appropriately pick up on those concerns and address those. It does actually lead to improved outcomes, and when we're working collaboratively with patients, then there are better outcomes in terms of treatment and overall health outcomes. And also it ensures we're picking up important things such as cultural sensitivity, so respecting and incorporating diverse cultural backgrounds and beliefs into our care as well. So like I said, with the NMC OSCE, you won't have a huge amount of time, but you need to address all 4 areas of the holistic assessment. So the first area is physical needs. Okay, so the assessment focus here is your kind of physical assessment of the patient, picking up on things from the medical history, the current symptoms that has brought them into your area of care. So in terms of your NMC OSCE, what is the primary physical complaint for your patient scenario? So what's brought them into hospital? So is it the asthma patient and they're short of breath? And I'm going to find out more about the shortness of breath. Is it my patient that's had a fall? I'm going to find out more about the falls. Is it my patient that has got a risk of malnutrition? So I'm going to find out more about their appetite and their what they've been eating, for example. So this is what you want to find out more about, okay? So thinking about things like, when did this symptom start? How often have they been experiencing it? Does anything make it better? What's been impacting on their other activities of daily living as well. So for example, if I have my patient with shortness of breath, so this could be my asthma, my pneumonia, my chronic heart failure patient, for example, I'm going to want to know a little bit more about, when their symptoms started, and when did your shortness of breath, it's become worse? When did it start? How long have you been experiencing this increase in shortness of breath? Have your current medications been effective or not effective? Does anything make it worse or better? So seeing if there's a trigger for that. And then, how is this shortness of breath impacting on your daily living and activities? They might say they're finding it really difficult to mobilize around the house because they're really, breathless due to chronic heart failure. So that can lead you into then another area to talk about in terms of mobility. So you want to pick up on one or two really key, relevant, physical complaints of the patient, okay, by looking at their history and from your assessment, okay. Again, like falls, so if I've got a patient that's had a fall, this could be the fall and fracture scenario, the subdural hematoma, the Alzheimer's patient can be at risk at falls. I might want to ask them a little bit more about their falls history. So can they remember how the fall happened? How many falls have they had over a period of time? Are they using any mobility aids, or are these helpful or not helpful? If they've had their fall at home, is there anything in their home environment contributing to the falls? And we can offer, as part of this holistic assessment, referral on to other services and specialists, but it always needs to be with the patient's consent. So be really careful that we are offering referrals with their consent and not saying that we are going to do things to the patient, okay? So I would ask my patient, would they like a referral to the physio or occupational therapy? If, for example, I wouldn't say that I am going to refer you, because I must get that patient's consent. Another area we might look at is malnutrition or reduced appetite. That can be quite common in some of the scenarios sometimes. So I might want to find out a little bit more about how much they're eating during a typical day, or how much of each meal are they eating. What type of food are they eating? Is my diabetic patient eating a lot of, high sugar food, and that could be impacting on their diabetic control. How much weight have they lost in the last 3 to 6 months? Are they managing to cook and make meals? So is there a social aspect here to their malnutrition? Might want to find out a little bit more about their favourite food choices, so we could offer those whilst they were in hospital. Do they need any additional support in the home for shopping and cooking? And again, would they like a referral to the dietitian? This is what the the must should suggest, but we always need to get the patient's consent. So there's a few ideas there around how to craft your physical aspect of your holistic assessment. And like I said, you haven't got a huge amount of time, but you do need to pick up on really key relevant symptoms and issues that the patient is experiencing related to that condition. Yeah, another one, for example, might be the Alzheimer's and the memory loss. You might want to find out if they're struggling with particular activities of daily living due to the memory loss. These could be things such as preparing food, or getting washed and dressed, or leaving the house and or driving. So all those type of things. So you can think about those type of things as well. Always look out for an opportunity for health promotion. So in your scenario briefing, does your patient smoke or drink? Are they having a high unhealthy diet? So these are things the NMC are expecting you to pick up around health promotion as well. So thinking about maybe asking the patient, how much are they smoking or drinking and how often? Have they ever considered reducing or stopping? And again, asking, would they like a referral to support services for smoking and alcohol cessation? So again, not saying that you are going to refer them, but offering that choice, seeing if they've given up in the past and if they've had any difficulties with that, and maybe look at a way that you could work with them to overcome those. So always keep a lookout for health promotion. The next part of your holistic assessment is psychosocial assessment. So the assessment focus here is around emotional well-being, mental health, those social support systems, coping mechanisms, can also include housing, for example, in your homeless scenario. So again, look for information in the scenario. Have they got a recent bereavement of a partner? That's really important to pick that up, okay? The NMC are looking for you to pick up if a husband or wife or partner has died recently. Are they showing any feelings of anxiety or depression? Are there any social issues, housing, accommodation, money worries? Another key thing to look for is, are they the main carer of a family member? So if they're in hospital, who is looking after the person at home who they normally care for? That's a risk area there that you need to be assessing and identifying, you know, if someone else, another relative is looking after that person at home, or whether you need to get in support services. So lots of things to think about then to pick out. So questions you can ask in your psychosocial assessment could be just something really simply like, is anything worrying you? Or do you have any emotional concerns or distressing issues that you'd like to talk to someone about? Or have you been feeling low in mood or very anxious? Or it could be that you see from the briefing that they've been very anxious or low in mood, and you can pick it up from that information as well. And then you could have some follow-up questions to that. So if your patient is very low in mood or very anxious, you know, would they like to talk to someone about that? And would they like some further support and help? If there has been a recent bereavement, then make sure you acknowledge that with your patient and show compassion and empathy. So it could be that, you know, I understand from your notes that your wife passed away recently. You know, I'm really sorry to hear that. This can be a really difficult time, being by yourself after being married for so long. So how are you managing by yourself? Have you got, you know, other friends and family who are supporting you? So make sure you're picking up on those things. Then on to your spiritual assessment. So your assessment focus here is on spiritual beliefs and practices and whether they impact on health and well-being, and also on health decision-making as well. So we need to know if there's any specific spiritual beliefs that are going to impact on the healthcare that we deliver. So look for information in your scenario. For example, do they normally go to church, or do they have beliefs that will impact diet and treatment? So see if those are in there first. And then you can just ask, you know, a couple of simple questions, or one question if you're really tight on time here. So do you require anything to support your cultural or spiritual beliefs while in hospital? You could ask if their current illness is impacting on their faith or spiritual well-being. You could offer if they'd like to speak to a chaplain or spiritual advisor. Or you might see in the notes that they regularly go to church, so you could lead in with that. So I can see you regularly go to church, and would you like for the hospital priest to come and see you? So make sure you're covering the spiritual assessment with one of those questions. And finally, sexual assessment. And this is focusing on really sexual health, relationships, family. Again, look for information in your scenario. Who's the next of kin? So next of kin is kind of like the first point of contact for that patient in terms of families. It can be a family member, it can be a friend, partners. Look out for same-sex marriages as well. So the ectopic pregnancy is normally a wife and wife marriage, and they've conceived through fertility treatment. Okay. And sometimes we can feel a bit funny, don't know what to ask around sexual assessment. So it could be just a really simple question like finding out who's the most important people in that person's life. I could see from the information that you're married. Do you have a good relationship? Are they supporting you? Or is your current illness impacting on your relationships? You could ask if their next of kin or their partner, husband, wife, are aware that they're in hospital, and if they want you to ring them. So my top tips for the holistic assessment part of your assessment station is to make sure you leave enough time to complete the holistic assessment. It is a marked part of the marking criteria, and if you do not cover it, you will be failed. Read your scenario and identify key and relevant information. Look out for health promotion opportunities, so smoking, alcohol, diet, make sure you acknowledge and address those. Look out for a recent bereavement or any care or responsibilities at home which you need to alert additional services to, so that person at home is also safe. Listen to your patient's answers. You'll have a patient actor, so acknowledge them and suggest ways to support them. Do not just move on with your questioning. Really make sure you are listening and engaging with that patient. Ensure you cover all 4 aspects of the holistic assessment, so physical, psychosocial, spiritual, and sexual health needs. And remember, your assessment will inform your care planning. So you should really be writing your care plans on the back of your assessment station. So those relevant assessment needs that you have identified should then go into forming your care plans. Okay, I hope you found that helpful. Like I put on all my videos, I am available for OSCE support and tutoring. I do one-to-one, or if there's you and some friends, I can do small groups, can make it a little bit more affordable. And really the best way to make use of my services is to practice and then come to me and practice your stations with me reviewing you, so I can give you feedback and mark you. And that's really the key to success in passing your OSCE as well. And you'll get access to all my resources as well, so all my teaching resources. And I can also just do mock OSCEs as well. If you just want to be put through that mock OSCE exam prior to your exam as well, you can email me on hannah.lames@outlook.com or visit my social pages, Instagram and Facebook, Nurse Tutor Tutoring with Hannah. Don't forget to like and subscribe and share my videos with any friends studying their OSCE or in any OSCE Facebook groups or social media groups that you're in to support other people taking their OSCE.